My name is Dr David Boshell. I'm a vascular and interventional radiologist and I work at Sydney Adventist Hospital. Well, a liver transplant is usually reserved for people who have primary liver cancer. So for patients who have secondary liver cancer, because they have cancer that is not only in the liver, a liver transplant is not going to be a definitive therapy. And when we actually provide immunosuppression so that the transplant can work, that can make the cancers worse. So we can't really give a liver transplant for people who have secondary liver cancer. For people who have primary liver cancer, liver transplants may be an option. There are certain criteria that people need to fulfill for liver transplant, just like having fulfilling criteria for SIRT therapy. The problem is that liver transplants understandably are a very limited resource, and it is difficult for people to get a liver transplant perhaps when they need, and so they go onto a waiting list. And the problem with people being on a waiting list for liver transplants is that the disease can progress while people are waiting on the liver transplant. So we may need to perform procedures in the liver to actually either bring people who have disease that is progressing back into the eligibility criteria for transplant, or what we would call downstaging. So these people may find a role for SIRT therapy to keep them on the transplant waiting list if their disease is progressing.